I'm a musculoskeletal oncologist or orthopedic oncologist, and that's the discipline, the subspecialty that's responsible for lumps and bumps in the musculoskeletal system, in bones, joints, muscles, tendons, ligaments. Some of those lumps and bumps, if you will, these tumors are benign, and some of them are more aggressive and malignant. The most common symptoms include a lump, a bump, and very often pain. The pain may be related to activity, as these tumors may weaken bones. Diagnoses include some very traditional approaches, and that is thoughtfully listening and examining a patient. Then we move on to our diagnostic imaging, and this frequently leads to the need for a biopsy. Then the key is for our very skilled pathologist to come to a conclusion about what this tissue represents, formulate the proper treatment plan, and implement it. Sometimes the therapies that are most successful are surgery. Often they involve medicines or chemotherapy, and sometimes radiation therapy, in combinations and in different orders. For the benign variant, the treatment sometimes is observation and explanation, giving a patient enough information that they feel comfortable with what's happening to them. People are interested in what they did wrong to cause this tumor, or what someone else may have done to them, or their environment. And there are some tumors that clearly have known etiologies. There are genetic and what we call epigenetic factors that we look for, and we have very talented geneticists within Yale Medicine. But by and large, we don't yet understand the cause of many of the tumors, benign or malignant, that we see. When I began my career, osteosarcoma, the most common, what we call primary malignant tumor of bone, the 2-year survival rate was about 10 to 15%. Today, coupling our surgical opportunities, our chemotherapy and immunotherapy opportunities, and at times our radiation therapy opportunities, the cure rate for those tumors approaches 80 to 90%. And it's been very, very gratifying. I now go to weddings and celebrations of kids that I took care of 10, 15, 20 years ago. I'm Dr. Gary Friedlaender, Chair Emeritus of the Department of Orthopaedics and Rehabilitation at Yale Medicine.